I've been working for about 20 years on a disease called Trypanosomiasis, which affects both animals and people. And I work particularly on helping farmers to find a way to better control trypanosomiasis in their livestock. Trypanosomiasis is a disease which has quite significant impacts on health and production. It's caused by a trypanosome parasite, which is carried by a tsetse vector. And in areas where the tsetse is present, it's quite a significant problem for farmers. Often in rural areas in sub-Saharan Africa, it's quite common for farmers not to be able to easily access advice from veterinary services or to access any diagnostics. So they are often trying to treat this disease in their cattle without very much input from anybody else. That means they tend to make a lot of use of trypanocidal drugs. So the work I've been doing most recently has been focused particularly on how we help farmers to have strategies for better use of trypanocidal drugs, or is there actually a resistance issue? So the aim of the funding from the Knowledge Exchange Fund was really to bring stakeholders into conversations about how we collectively design strategies for better trypanosomiasis control. So we put on a 3-day symposium in Tanzania. What the fund enabled us to do was to bring together really everybody who is involved in aspects of trypanoside use in the trypanoside supply chain. So we were able to bring together researchers and scientists across affected countries and then also from Europe and the States, with policymakers, decision makers, people from veterinary services in affected countries, and also with people in the supply chain, so with distributors, pharmaceutical companies, and funders of research in this area. In organising the symposium, we had 2 really key partners. We worked with Giuliano Cecchi, a Food and Agriculture Organisation of the United Nations. Our other partner in the organisation of the symposium are our collaborators in Tanzania at the Vector and Vector-Borne Disease Institute.
Almost 1/3 of this country is infested with these tsetse flies. And unfortunately, most of the national parks, all the tsetse flies are there. So it is not a risk of animals alone, it is a risk of human as well. We call people from the labs, we call people from the field, and then we tried to exchange ideas to formulate a way forward on how to handle this situation of trypanosomiasis.
I think the symposium was very successful in bringing people together. We got extremely positive feedback. People were very keen to know when we were going to organise the next one, which was not something we'd planned on, but may need to think about. Because I think Tanzania and the research we've done has become quite an exemplar of really getting into these issues of treatment failures and of how we really try and help farmers to do better control.